Hey everybody! So in this video, I'm going to be showing Talia and you how to do some pretty basic exercises specifically for adults with paraplegia. So exercise is a really important part of rehabilitation. It not only increases your mobility, but helps decrease some secondary complications. And what I'm going to be showing you are some really basic exercises and just a way to get started. However, if you're newly injured, pregnant, or have medical conditions, please make sure to talk to a healthcare professional before starting exercising. And what we're going to do is we're just going to start off with a quick breathing exercise. I'm going to have Talia breathe in and out quickly at a fast pace, and it's important that you inhale and exhale equally. So this isn't to be confused with hyperventilation, but you're actually exhaling more than you're inhaling, and this kind of leads you to feel dizzy and a little nauseous. So you're going to do this for about 45 minutes. Ooh, no, you're going to do this for about 45 seconds. And what we're doing is we're building endurance in our respiratory muscles, specifically the ones that help you draw air in. And if you exercise daily for after about 5 or so weeks, you end up seeing an actual difference in how much oxygen you take into your body with each breath. And what this means for you is that you have less fatigue and you're able to go about your day without feeling as tired. There are no adverse effects with respiratory training, but if you start feeling dizzy, nauseous, a little lightheaded, it is important that you stop, take a couple of deep breaths, and slowly return your breathing back to normal. Talia, how you feeling? Excellent. So we're going to start with our aerobic exercise, and specifically we're going to be doing 3 movements from chair yoga. So the first one is we're going to have placing your left hand behind your back, taking your right arm at your elbow, and gently leaning your elbow and yourself toward the right side. In here, it's important that you hold this position for 5 seconds. You're going to feel a light tension, and then you're going to break. And then on the other arm, you do the same thing. So take your right hand behind your back and then lean. You can hold this position for 5 seconds, and you're going to feel a slight tension down where your ribs are and at the back of your hand. Excellent. So now you're going to take your hands, you can put it straight down, and you're going to push down. So it's important that you have good posture, straight back, and you push down for 5 seconds. And then you're going to slowly take your arms out into a T position. So here, you're also going to push for 5 seconds. It's important that your arms are straight out and parallel with the rest of your body. So now you're going to move on, put your hands straight up and push up for 5 seconds. You don't want to lean, so you do want to make sure that you're standing really straight. And then after 5 seconds, move your hands down slowly to right in front of you, and you're going to push forward. So here, you are going to be feeling tension right across your arm, and that's a good thing. And lastly, we're going to end with shoulder shrugs. So you're going to do 4 shoulder shrugs, holding each shrug for 5 seconds. And here what's important is that you're not pushing your shoulders forward, you're actually sitting straight up and moving your shoulders as close to your earlobes as you possibly can. So this is 1 cycle. You're going to repeat the cycle again, and if you're feeling like you're still energetic after that, you can do it another time to really get the most out of this exercise. So aerobic exercises, there are many different examples. Chair yoga is just one. But in general, what they do is they not only strengthen your muscles, but they also help with your endurance and with limiting weight gain. Lastly, aerobic exercises are really good for cardiovascular benefits. So what this means is that it actually helps your heart work more efficiently, and at the end of the day, you end up feeling like you're able to do more with less effort. And if you're feeling like this exercise is still a little easy for you, you can increase your hold positions. So instead of doing 5 seconds, you can do 8 or 10. On the other hand, if you're feeling like it's a little too difficult for 5 seconds, you can decrease this and only hold for about 2 or 3 seconds in each position. And lastly, how are you feeling? Excellent. Okay, so lastly, we're just going to cool down. And if you're in a wheelchair, you can just roll around for about half a minute. For us, we're going to be doing some gentle stretches. We're just doing some head rotations. So tilt your neck to one side, feel the stretch. The same for the other side of your head. You want to feel that gentle stretch in your neck. Then we're going to end with a chest stretch. So you're going to move your arms back and feel that tension in your chest and the back of your arms. And the reason that a cool down is so important is that you want to slowly decrease your heart rate and not stop abruptly. So thanks for listening. Hopefully I've inspired you to start exercising and start working towards the Canadian guideline, which for healthy spinal cord injury adults includes 40 minutes of aerobic exercise a week. And you can find a lot more information posted down in the links below. They are guidelines from CSI Action Canada and CSI Ontario, and also some facilities that have specified exercise programs specifically for people with spinal cord injuries. And if you liked our video, please check out our channel for more demystified medical topics.